There we go. Much better.
Thank you.
Excellent. Okay, so I want to thank you all for coming today and spending your Saturday with us. This talk is mainly concentrating on the natural approaches to pain management. Many previous talks have concentrated on medication options, including cannabis, low-dose naltrexone, and as well as all of the medication options. Those are all available on YouTube, and you can find that just by Googling Joanna Harper in pain management or just Joanna Harper and Scleroderma. My history and years of talks are located there. Like Christina said, I do have scleroderma myself. I also have lupus. So between the two, a lot of what I've learned is mainly through experience and then doing further research based on either what patients bring to me or my own experiences. So I wanted to make sure that I was as inclusive as possible in this talk, but it is only an hour, so I did what I could with the topic that we have. I will be doing a recording for the medication portion, as well as presenting it live again here for the Scleroderma Foundation of California in the near future. Okay, so the objectives are, appreciating the role of inflammation in scleroderma, understanding how healthy nutrition, exercise, sleep, and mental wellness habits can improve your pain management, and that includes nutritional needs, as well as foods that can help. Incorporating movement in your daily activities, recognizing the role of vitamin and mineral deficiencies that are associated with medications, because I think many of the medications do create a vitamin and mineral deficiency, and that's noted in literature. And so we're looking at all these different ways, natural treatments to treat different types of pain. So we will be talking about inflammation and neuropathy, as well as muscle pain and myofascial pain. We will talk about different physical techniques to reduce the pain. And then at the end, we will talk about how to choose appropriate providers and what are red flags for providers or when people are advertising on social media and so on and so forth. So the goal of this is for you to develop an actionable or a plan with actionable items, things that you can actually implement in your life to improve your pain. So if you can just take a few things from this talk and incorporate those, you're definitely going in the right direction to help with pain. But any lifestyle modifications are going to take time. So it's not something that you can do overnight, and it's not something that's easy, but it is possible, and it is something that really does make a dramatic difference in your life once you can get those changes made. So disclosures, I have nothing to disclose. I don't work for a drug company. I don't work for any industry. I don't get paid for anything involving these talks, but I do talk about a lot of off-label uses of vitamins, medications, things like that. So this particular talk, although there is a mention of medication here or there, most of it is vitamins and minerals, and most of it is based on literature. So, and as Christina talked about, by no means is this meant to uh, forego any information from your healthcare providers. It is important to have that conversation with your providers to make sure that what you are going to do is the most beneficial for you in your life and where you're at with your medications and your disease process. So we're going to talk about inflammation. We're going to talk about healthy living, the vitamin and mineral deficiencies, the medications that cause those, herbs and supplements for different types of pain, as we talked about. I did not go into detox today because I did not have time for that, but we will talk about body work as well as choosing providers. So it's really important to note how much of a process or how much inflammation plays with scleroderma. So it is a natural defense system and one that's really essential for our survival. When the body's damaged, the immune system sends white blood cells to destroy any damaging substances. And it's there to heal tissues and return the area to a state of balance. Unfortunately, with chronic inflammation, there is tissue breakdown that's associated with it. So chronic inflammation is when the threat when the threat is gone, but your body can't get rid of the offending agent, or your body feels like it can't get rid of the offending agent. So basically, the body is trying to get rid of something that's already gone. So basically, the immune system goes into like a fight or flight mode, a threat mode when no threat actually exists. So some of the unhealthy lifestyle some of the unhealthy lifestyle habits that happen, smoking is huge for inflammation. I can't stress that enough. I know from the last 20 years, we've gotten a whole lot better as a society and as a scleroderma community on understanding the importance of quitting smoking. But I can't stress that one enough. That one is actually really incredibly high in producing inflammation. And then we will talk about the diet and the lifestyle. Weight gain itself does cause a considerable amount of inflammation, as well as excessive alcohol. So any type of more than a drink or two a day is excessive, and that's definitely something that can increase the inflammation in your body. And this chronic inflammation not just increases scleroderma, but it also can lead to allergies and asthma, which is also an inflammatory response. Anxiety and depression, the brain fog that we talk about is associated with inflammation. Alzheimer's later in life, cardiovascular disease, and even cancer. So inflammation is really, really important topic to discuss. So with scleroderma control, I want everybody to understand that if we can decrease the prostaglandins, that leads to less inflammation, that leads to less pain. So better scleroderma control leads to less inflammation. So I am in the camp of, I firmly believe that patients, if you are in an active disease state, and it is rapidly progressing, it is vital to use those medications that our rheumatologists recommend to get the aggressive forms under control. It is incredibly difficult to get aggressive forms of scleroderma under control without using those medications. And usually it's prednisone first, and then immunosuppressants or specialty medications. But I have seen many patients who have their condition has declined significant by trying to do just supplements or functional medicine or over-the-counter products. So I do feel that it is important to note that I do believe that getting that scleroderma under control first is really important. So we will talk about nerve pain in this talk. And so nerve pain is classified as that tingling, numbness, stabbing, and electrical type pains. They can come across as pins and needles. It can start quickly. It can come and go. It can be consistent. It can be mild or severe. So there's all sorts of different ranges for neuropathy. It can be caused by tissue damage or nerve damage or inflammation. So inflammation can cause neuropathy as well. Any type of amputations as well, all of that can contribute to neuropathy. So when I talk about neuropathy and medications or vitamins that can help, those are included. So we're going to talk about nutrition for just a minute, just because of the importance associated with this. So a lot of nutrition is based around, the American diet. We are very used to something quick and easy, and oftentimes that is processed food or fast food, which has a lot of additive ingredients that are not good for us also. So really looking at an anti-inflammatory diet, or looking at eliminating inflammatory foods. So sugar is one of the most inflammatory products that we have, and the addictive properties actually make it harder to get off of that. Processed foods, anything with more than 5 or 6 ingredients are usually processed foods. If it's something that you can't pronounce, it's usually something that is not natural. And that is harder on the body, and it does create more inflammation. Dairy is inflammatory in itself. I don't necessarily recommend going dairy-free because it is incredibly difficult to do. If you can, that is fantastic, and it will decrease your inflammation. But if you can limit the dairy significantly, and Fairlife is a good step down from using milk. That's another product that filters out the lactose. Gluten is another one that I would not say, if you can go gluten-free, that's fantastic, but it is hard to do. So it's about a ratio. The more inflammatory foods that you eat, my goal for my family and myself is to eat 80% of the good stuff, the natural, no inflammation type foods, and then 20% on the splurge of every now and then having a treat. Saturated fats is another one that's not necessarily good for us, as well as fried foods can all increase inflammation. It is really, really important to do 6 to 8 cups of vegetables a day. So eating the rainbow really is eating a different color of the fruits and vegetables is really important. If you can do a smoothie, there's all sorts of recipes online. That's a very quick and easy way to get that in your diet. Increasing water intake. Soda can actually decrease the thirst impulse, as well as it can dehydrate you. So not recommending soda, although if you all know me, that has been a huge problem for me through the years. And then for any of these diet and lifestyle changes, start really small with something that you know that's easy to do, like low-hanging fruit. So oftentimes that's picking one food that's bad for you on the list, replacing it with one that is good on the list, and then basically waiting a couple of weeks to try something else. It is important to find solutions to any problems. So Google is helpful. The support group Facebooks can be helpful in just finding other options. Journaling is very good to determine what food intolerances you have and what seems to bother you, because it is not a cause and effect, and it doesn't happen right away. But that will help also with mood and with your vitamins and changing your routine to see what really is helping. And then food prep. Food prep is really important as well. And so looking at preparing food ahead, finding 2 or 3 recipes that you really like that are on the low inflammatory diet lists, and then bulking those to where you freeze half of it, and you can it's basically a microwavable dinner at that point. Although I do recommend the stovetop, but and then food fear is real. So a lot of functional medicine and nutritionalists, dietitians, we say all of this food is bad. Yes, that is true. There is a lot of inflammatory foods in the American diet, but having the food fear based around that is actually counterproductive and often does not help patients later on actually have a healthy diet. So really staying away from the whole fear idea of food and just trying to basically decrease the things that are not good for you. So a lot of the vitamins, we'll discuss the vitamins that are important in pain management. Most of these vitamins are available in a healthy diet or a diet, and diet is the preferred route for these vitamins and minerals. I know it's difficult with scleroderma patients to eat enough, and some of the foods don't work well with us. So the goal here is to eat a variety of the foods that are here, and to have a multivitamin too. A complete multivitamin daily usually has enough of the vitamins for most people, including like the fat soluble, like A and E. For example, A, D, and E, or A, D, and K. And so those are important. So long story short, the multivitamins here at the bottom, one multivitamin by Pure, Orthoimmune is another one that you can use, or the MitoCore are all possible options for a multivitamin. But It's really important to note that all of these vitamins do play a role in pain management. So vitamin A, C, E, selenium, and zinc support the immune system and decrease pain. Vitamin C, E, selenium, and zinc are also antioxidants, not vitamin A necessarily. Antioxidants prevent or protect cells from damage from environmental insults, whether that's smoke or UV rays. And it's also we also have natural byproducts in the body when we destroy viruses, bacteria, and other damaged cells. That creates these oxidants that we need to get rid of, or things that the antioxidants can help mop up. So vitamin A is necessary for functioning of the immune system, and it's also required for skin and the mucosal lining integrity. So that is something that is really important to us, and that's found in yellow, orange, and green vegetables primarily. All of the foods listed here are in order of high potency as the first listed, low potency as the last listed, or lower potency. I did not list everything that's available, but these are just to give you an idea. And it also gives you what pain it treats. So vitamin A can treat inflammation and myofascial pain. We do go through the supplement dose, what's recommended. So RDA is the recommended daily allowance. And then deficiency in vitamin A can cause dry eye. And then that is a fat soluble vitamin. So we do not recommend supplementation on its own for vitamin A as well as vitamin E. Vitamin C is also important for inflammation and myofascial as well as vitamin E. The dosing there is available, but something to watch out for is vitamin C can cause kidney stones if in too high of doses. So it's really important to not take incredibly high vitamin C doses for a long period of time. Selenium is another one that has, it's necessary, but it also can be dangerous in high doses. And so high doses can cause hair loss, and then your nails to be brittle. So, like I said, I don't recommend supplementing those higher than the doses here. And then zinc is another one that's the bioavailability is high in meat, eggs, and seafood. And then excessive chronic use can lead to copper deficiency. There are some drug interactions there as far as keeping 2 hours apart. So basically this chart, as well as the next one, is good to keep on hand for different types of pain that you have, different treatment options, and then the concerns that we have for zinc level or for toxicity levels. And then vitamin B12, D, and magnesium are also other vitamins and minerals that are important. Vitamin B, basically chronic GI inflammation can lead to low vitamin B, which can cause fatigue with that one. It is one that is not fat soluble. So often if you take more, then your body will just eliminate it. But it is good for inflammation and myofascial pain. Vitamin D is good for all of the pains, including inflammation. Really, the vitamin D goal should be 40 to 60 nanograms per mil when you do your blood tests. But it is not recommended going more than 5,000 international units per day. And that's with monitoring. So too high of vitamin D levels can cause a loss of appetite, nausea and vomiting, severe itching, which is important, as well as muscle weakness and joint pain. So it is possible to get too high of vitamin D. But it is used for inflammation. It's used to help modulate the immune system, as well as hormone balancing. It is a very complex feedback loop associated with bones, liver, kidneys, parathyroid, and the small intestines. But it is the foods, it's really difficult to get it in the food. Usually it's supplemented or say fed to the chickens in eggs. So sun is the best for sun exposure. Doing short periods of time without sunblock for 15 to 20 minutes is the best way to get the vitamin D. And then magnesium is also a very important one that can basically help with inflammation. So the magnesium malate is the one that's important for inflammation, and the magnesium glycinate is better absorbed and also better for sleep. So you can use different magnesium supplements throughout the day. Too high of magnesium will cause diarrhea and then malabsorption issues. And then, of course, diarrhea and the malabsorption will cause low magnesium levels. So high doses will cause diarrhea. Think colonoscopy on that one. Okay, so medications that can cause vitamin deficiencies. So the proton pump inhibitors like Prilosec and omeprazole are listed many times on this list. So take some time to really review this list, watch the video again, and pause it so that you can see all of these. But basically the prednisones or the corticosteroids, prednisone, methylprednisolone, hydrocortisone, all decreased levels of vitamin D and zinc. And then the Prilosec and the H2 blockers like famotidine and cimetidine can all decrease the vitamin B12 as well as vitamin D and zinc. So our medications do interact significantly with these vitamins. And then also magnesium, calcium, and potassium all are affected by the proton pump inhibitors, the H2 blockers, so anything used for acid reflux. So some supplementation may be necessary for those. There are other medication-caused deficiencies, but I only concentrated on the important ones for scleroderma patients and did not go into every single one. So supplementations for nerve pain and inflammation, the omega-3 fatty acids, they are in salmon and sardines, basically fatty fishes, as well as walnuts, flaxseed, and chia seeds. It does increase your risk of bleeding, so stopping 1 to 2 weeks prior to surgery is important. And then the supplement dose is usually 2,000 to 3,000 milligrams per day, but avoiding the cod liver oil because cod liver oil is high in vitamin A. And then turmeric or curcumin is important. Curcumin is the active compound of turmeric. It's a good anti-inflammatory and antioxidant. It's a spice available for food. And then the supplement dose is usually 500 to 1,000 milligrams, dose 3 times a day, but you don't start at that. You usually start at the lower dose once a day, so 500 milligrams once a day, and work your way up. Studies that showed decreased inflammation was at 2,000 milligrams per day for 3 to 4 days. Ginger is also a cousin to turmeric. It does also inhibit prostaglandins like Celebrex or celecoxib. So it is anti-inflammatory as well as antioxidant activity. And there is also another pain receptor that is worked on as well. So there's all sorts of benefits for ginger too. And then quercetin. Quercetin is also another good supplement. It does decrease inflammation specifically in the nervous system. It does actually work on pain receptors as far as the pain's reactivity to pain or the brain sensation of pain. It does decrease the oxidative stress as well as works on GABA. And the opioid receptor is very similar to like gabapentin and opioids, not to the same extent, but it does work on those receptors. So that's 250 to 1,000 milligrams per day, usually in 2 divided doses. And then the studies used up to 100 milligrams per kilogram, which is quite a bit. So basically roughly 100 patient weighing about 100 pounds. That's actually quite a bit more than the recommendation I gave here. So basically my point is the studies, it is safe because the studies have used it at a much higher dose for up to 8 weeks. Other nerve pain supplements, specifically for nerve pain, alpha-lipoic acid is one that I've used in clinical practice quite a bit. I had quite a few patients get really good pain relief from it. It does have neuroprotective activity as well as anti-inflammatory properties. It can decrease blood sugar in diabetics, so that is something to watch out for if you are on other medications to decrease blood sugar. And then starting at 200 milligrams a day for about a week, increasing to twice a day for a week, and then 3 times a day for 2 to 4 weeks. That helps. So if you do the maximum 200 milligrams 3 times a day for 2 to 4 weeks, and then decrease back down to 200 milligrams twice a day, that's the recommended dose. If you tolerate the medication, but usually I like somebody to start at once a day to make sure that they can tolerate the medication. Vitamin B complex is another one that's really important for nerve pain. Boswellia, as well as acetylcysteine and N-acetylcysteine, which is NAC. You may see it listed as NAC on supplement bottles, and the dosing there is listed with the toxic levels as well. And then foods for inflammation, we talked about ginger. If you do want to use it as something for a supplement, it's 500 milligrams every 4 hours with a maximum of 2 grams per day. Too much will cause heartburn and diarrhea, and then it can be used to help with nausea and digestion. It's found in teas, and you can use it in food. I do put it in a smoothie as well, which helps to get that into my daily nutrients. Other foods that can help for inflammation: olive oil, green leafy vegetables, which on that vitamin chart, many of those vitamins are found in green leafy vegetables. And then nuts, such as almonds and walnuts. Peanuts are not really a nut. Fatty fish, like salmon and tuna, as well as fruits. So like strawberries, blueberries, cherries, and oranges can all be helpful to decrease inflammation. So there are topical anti-inflammatories that are available. They do have limited systemic absorption, meaning you don't have a lot of the same side effects that you would have with one that you would take orally, and it doesn't interact with medications the same. You may use multiple topical products, separating them out by 2 hours for best absorption. So some of the products available are diclofenac gel, over-the-counter, the high-dose CBD creams or ointments can help. There are salicylate type products like Salonpas, Blue Emu, or Bengay. And so menthol and camphor have multiple mechanisms to treat pain, and it desensitizes the body to the pain response, so that can be incredibly helpful. And then camphor has vasoactive properties, which has been shown to improve blood circulation, which is helpful for Raynaud's in both the skin and the muscles. And it also does improve, the decreasing of inflammation. And they have been found incredibly effective for nerve pain in particular, but also anti-inflammatories. So there is dual benefit there. Tiger Balm and I think it's Arnicare are also in there as well. And then other topicals include lidocaine. I know one of the questions had discussed lidocaine as one of those options that they used and that they found really effective. So lidocaine and then prilocaine as well. They do have creams and patches available, and some of it is approved by the FDA for neuropathy. BioFreeze is another product that has the menthol and the camphor in it. Capsaicin often is hard to tolerate because it is incredibly warm, but I have had some scleroderma patients say that it's helpful because it makes them feel warmer, especially when they're having Raynaud's. And then there is available compounded creams like ketamine and lidocaine that I compound in the compounding pharmacy to help with nerve pain as well. So for exercise is incredibly important. I know we talk about this a lot, but exercise releases myokines and endorphins. Endorphins are neurotransmitters in the brain to improve mood and a sense of well-being. And it also provides a short-lived sense of euphoria, which is helpful. And it also helps promote neuroplasticity. And so neuroplasticity is your brain's ability to create new neurons and new pathways. And in chronic pain, that means that your brain is learning how to translate the pain better and decreases your pain sensitivity. So even if it's just a little bit of activity, that little bit of activity can help decrease anxiety, improve sleep, and decrease brain fog. But it also can decrease autoimmune activity if done correctly. So we talk about basically doing what you enjoy. So hiking, swimming, dancing, anything that you find fun and active to get your heart rate up is helpful. And if that just means, getting up and walking just a little bit is helpful. Even just a 5-minute dance party, even if it's in your chair, it's getting you active and getting that heart rate up a little bit. Any type of sedentary lifestyle and repetitive movement can worsen pain. So the more movement you can get through exercise, the better off you are. Avoiding high intensity, because high intensity will actually increase inflammation. Finding that time of day that it works best for you is ideal. Setting really small setting goals and starting really small. So there is a theory that you want to be 1% better every day. And that 1%, if that means that you just go for, a 3-minute walk around the house, and then keep increasing that every day. The goal is to be consistent and continue with the 3 minutes every day. And then slowly increase on that. And with Facebook groups and other online support, it's good to find an accountability partner, somebody that you can do it with, that can help motivate you on those days that you're not feeling very motivated. And even just talking to a friend on the phone while you're doing those exercises can help take your mind off of it and help decrease anxiety at the same time. Hopefully, depending on the friend, I think I should say. And so the goal is to exercise safely. So ask yourself, am I going to be okay tomorrow? Is this safe for my body? So you push it to the edge. If you can keep breathing and stay calm and keep your muscle tension low, that's kind of where you should be for exercise. Monitor the pain level and don't ignore it or pay too much attention to it. So basically the goal is to be right on that edge of what you can tolerate. And that way you can push yourself a little bit more every day. And it is important to note that it is hard initially. So again, just a few minutes a day, give yourself grace on the days that you can't do it, but the goal is to pick up and do it again tomorrow. It is so important with how exercise helps reduce pain. It may not be noticeable the first day or two, especially if you're building muscle. It can increase pain if you're building muscle, but know that that is short-lived and that is, getting you a healthier body in the long run. So the goal is to continually challenge yourself. So with musculoskeletal system, a lot of scleroderma is related to fascia and skin and other connective tissue. So the musculoskeletal system is comprised of bones, muscles, joints, and all the connective tissue that binds them all together. And it enables all movement. And so fascia is one of those. And in these pictures, it's the fascia. So fascia has these little vesicles that actually move through the body along the fascia. And so it is incredibly important to maintain healthiness of that fascia. And I think as we see more research in scleroderma, we're going to see more fascia related articles, hopefully. But if you go to Strolling Under the Skin by Dr. Guillaume Bruto, it's really awesome to see exactly how our body communicates using fascia. But it really is, the human body is one tissue. It's one connective tissue. So I've had patients where, they're having fascial work done on their ear and they can feel it all the way in their toes. So even though it isn't nerve related necessarily, it is communicating similar to what nerves do. And so some of the ways that we can treat myofascial pain will be listed. But myofascial pain is musculoskeletal pain, and it's one of the most prevalent forms of pain beyond inflammation for scleroderma. So those two are really the highest pain. It can mimic many other pains, and then inflammation does make myofascial pain worse. And so there's all sorts of different myofascial pains. Trigger points, which we've heard of trigger point injections. There are also physical techniques that you can use to help decrease those trigger points. And we'll go through some of those. And then, so the other one that's really important is there is a distortion. Sometimes it's the folding distortion, but the scleroderma with limited scleroderma sometimes is related directly. Well, oftentimes it's related to fascia and that it is stuck. So it's another myofascial type distortion. And I have had success with getting movement with those with a physical therapist that I've used. I do have systemic, but I have had patients with limited that do have good results using these myofascial techniques. And so exercise is the best way, just getting up and moving. That's the first step. There are physical and occupational therapists that do specialize in the myofascial distortion model. And so the link is there where you can find a provider in your area. Dry needling and a TENS unit are also available. Conventional physicians will use a TENS unit, and they are available online as well. And then home activities. So stretching, using stretch straps, large yoga balls, doing yoga helps with that. Yoga for scleroderma. Love them. They do help. They do have lots of different videos for you. Qigong is another one, and I did include a link there. That's incredibly slow, but it helps you with various different types of movements, as well as decreasing anxiety. Tai Chi is another one. Myofascial tools is on the next slide, so we'll talk about that in just a second. And then increasing water intake is absolutely vital for myofascia because those vesicles need to move and to communicate. So myofascial tools, there's the therapeutic massage that's available. So somebody giving you a therapeutic massage, but you have to specifically ask for a therapeutic massage or a Thai massage. And then a foam roller, as you see in the above picture. Believe it or not, that does move myofascia quite a bit. It can cause pretty good pain the next day, but it's helped moving that myofascia. Tennis ball, 2 tennis balls and socks can help with the trigger point injection. Using the exercise ball to increase kind of your mobility. The one in the middle on the bottom is a trigger point massager. So you use that on your back to get the trigger points associated there. And it's based on how you feel. So you put it on an area that hurts and you push a little bit, again, going to the edge, and then holding it there for just a few minutes. And then the jackknobber is another one that can be used that has the similar activity as the trigger point massager. So stress management is incredibly important. Increased stress leads to increased cortisol, which decreases the immune function. And then that also decreases serotonin and dopamine, which increases anxiety, depression, decreases sleep, and decreases satisfaction in life and concentration. So it can lead to adrenal fatigue over time. So it's really, really important to address some type of stress management, even if you don't feel like it's stressful. It's amazing how stressful it is just living with scleroderma. Any of these breathing techniques, you can actually Google how to do them. So two-compartment breathing, alternative nostril breathing is another one, using colors and words. So you breathe in and think of colors, say red, and then you breathe out and think of blue. And you do that slowly over, 3 to 5 minutes. There's also box breathing that has a diagram with it. And then the body scan where you start at your toes and work your way up. So there's all sorts of different techniques available to you. Please look for those. And then there will be videos associated on how to do those. And then meditation is another one that's really important. Meditation does not mean that your brain goes completely blank. It just means that you're trying to bring it to a state of stillness. So it's kind of reminding yourself to come back. So guided meditations are the best way to go. For beginners, oftentimes they can help guide you through the process and you get the same effects from it. So there's different apps there for those. And then sleep is incredibly important, coming up with a healthy sleep routine, the same time every night, decreasing electronics 30 minutes prior to, 30 minutes to an hour. So no electronics, no TV, no phone. Doing meditation before sleep can help. And then keeping that routine so that your body needs to know that it is bedtime. And obviously the sun does play a significant role in that, or when the sun goes down. So there are supplements available for sleep. Melatonin is one. It is a hormone, so it is something to use cautiously. So I don't recommend more than 5 milligrams, generally speaking. Magnesium glycinate is another one that can be helpful, as well as L-theanine is another one that helps with decreasing of anxiety. Same with the magnesium glycinate. Low THC cannabis can help, as if it's legal in your state. And then glycine and valerian root can also help. And then GI pain is also something that I just wanted to touch on briefly. So making sure that you have a bowel movement every day is really, really important, both to get rid of any type of toxins, but also for healthy GI functioning. And so using probiotics and fiber can help with those. My email is in the last slide. So if you do need specific ideas or recommendations, usually for probiotics, I recommend multiple different strains, not just lactobacillus, but there's other ones that you can, so just make sure the list of ingredients is a couple of different ones. So that's usually what I recommend there because they're easier to obtain and they do work pretty well. And then there are increasing the fiber in the diet, obviously. So green leafy vegetables actually do make a big difference. So a smoothie can actually help. If there's high in vegetable content in the smoothie, it can help with the bowel movements daily. And then we talked about ginger briefly. And then digestive enzymes can help as well. I would speak to the physician about those. They are available over the counter, but they can be helpful. If it is too much of a dose on the digestive enzymes, it can actually decrease or increase acid reflux. So that is really dose dependent. And then the B complexes can help as well. And then for itching, this is the list for itching. I did not plan on talking about it today, but I wanted to include this in the list. If you do want a copy of the slides, I can provide those afterwards to Christina. Because the slides are very heavy in content. So I don't expect you to know them all. But everything that we've talked about before, as far as anti-inflammatory supplements, but also evening primrose can help, and avoiding fragrances and other additives in lotions and making sure you moisturize well. And then low-dose naltrexone I have seen work really well. Essential oils, we're going to just talk about very briefly. There are a variety of essential oils that can help, that can actually be just as effective for some of the conventional medications. And we'll talk about that in a slide or two. But lavender is good for pain. The soothing blend, deep blue or cool azul, depending on which brand you use. Anti-inflammatory, I use a lot of lemongrass and peppermint, and I have used topical solutions. And then both with analgesic and anti-inflammatory properties are bergamot, and bergamot is one of those that they're doing more research on for a full effect of anti-inflammatory and anti-nociceptive, so the brain not perceiving the pain. And then frankincense is used to reduce nerve pain. And then peppermint alone is good for GI discomfort and irritable bowel syndrome. So this slide is all about the research that has been done, and then what pain it's used for: acute pain, chronic pain, inflammation, nerve pain, or other. And then what the safety concerns are for each one of those. So again, I will provide the slides for that, but just know that some of these should not be applied to the skin directly, and they need to be diluted, like copaiba or copaiba. I've heard it different ways, but you have to dilute that one, but that one is incredibly effective for inflammatory pain. And so that's one of those that can be used, and they can be used without having a membership too. And then, so like lidocaine is a calcium channel blocker or a sodium channel blocker, and so is lavender. NSAIDs like ibuprofen and Celebrex, which I didn't spell that right either. And then so ginger and frankincense and Roman chamomile can also work similarly in the same mechanism. And then mu receptors or the cannabinoid receptor for copaiba. So that's another one that's really important. And then lemongrass can be similar to the effects of gabapentin or the benzodiazepines like diazepam. And so body work is also really important. So working with a chiropractor or an osteopath or osteopathic medicine, osteopathic manipulation, deep massage or therapeutic massage or Thai massage like we talked about. Acupuncture is another one, as well as using heat and ice. There is energy-based healing, which you can do more research on. Reiki I found very effective for some patients, but these are all different options as well. And then determining success. So it's really important to maintain a pain diary or a log. There are really cool apps available now. Every app is a little different, so you just have to click through them and see what's going to work for you the best. There is also charting, bullet journaling or bullet journal charting is really fun. And there's different techniques, so just Google that and it'll show you exactly how to do that. But basically the goal is document what you've learned, document all of the different tools that you used, what worked, what different, including supplements and vitamins. And then that way you can help pinpoint what was helping and what wasn't, because I don't know about you, but 3 months ago, I don't know what I was doing specifically every day. And so you always want to develop different tools. Pain management is completely different for everybody. And so looking at trying different tools, trying them a couple of different times, and then moving on to other ideas, talking to other people about what things have worked for them, always continuing to learn, using reputable sources. Hopefully, Google is good in some ways, but make sure like Harvard Medical has a lot of really good sites on pain management. And then pain management also, practical pain management is another one. So join support groups and get involved. Learn to celebrate those successes, both with yourself and really take that time to celebrate that success. And then also with, your colleagues and hope your friends and hopefully your accountability partner. And then learn something new every day. So that's going to be one of the most important. And then that 1%, always try to improve 1% every day. So this is the pain toolkit. It's a free resource to everybody. Goes through everything that I've talked about in sometimes more detail, sometimes less detail. But it's a really good system that was set up, and I've used it for many of my patients. And then daily planning, looking at what is your plan for success today? How many breaks are you going to take? And how long? How are you going to calm your nervous system, and how many times do you need to calm your nervous system? And then challenging your ability, and then trying to see if you can improve every day. So my last topic is choosing a provider. So I know everything I've talked about. There was a lot that I've talked about, and I will provide the slides at the end so that you can have all of those resources. So today is to give you an idea of all the different options without going too in detail of any individual one. But choosing an appropriate provider is one of those subjects that has been a real concern in the community, especially the scleroderma community. And so I really wanted to address this. So make sure that they are licensed to treat human patients. I know that sounds silly, but who is their licensing board? Who do they answer to? So whether that's the medical board, the pharmacy board, the Academy of Nutrition and Dietetics, very, very important, because if they're not board licensed, there is no protection for you. They can give you incorrect information, they can harm you, and there's nothing that can be done about that. So with dietitians in general, or anybody giving food advice, there is a significant food fear, like we talked about, and it can severely negatively impact your eating habits in a negative way if it's done improperly. So it's really important to make sure somebody is licensed and that they have a suitable degree in a medical science. That is searchable. I would search it. If they say they have a doctorate degree, I would look up that doctorate degree. If they say they have a license, I would look that up and see for yourself. Don't take their word for it. Are they certified, and evaluate that program? What's the requirements? How long is the course? Is it a 2-minute course, a 30-minute course, a 3-year course? That really does make a big difference. And then what is their scope of practice? So a life coach cannot provide supplement recommendations, and they cannot run testing. Really, really important to notice that. There's a lot of testing companies and a lot of supplement companies that allow just about anybody to have an account. I do not recommend those. Those people make money on every one of those supplements and every one of those tests. Some of those tests you can find on your own, but finding a credible physician is the most beneficial. So there's the practitioner sites there for the IFM, which is the functional medicine group, and then Farm to Table is a group of pharmacists that are licensed and certified to do this work. They are screened very closely in order to provide you good information. So, other red flags when choosing a provider: is there a contract? Even if they don't say it's a contract, if they say, please sign here, do not sign until you have full information. You want a full copy of that contract sent to you in email. Read through it very carefully, and I would recommend having an attorney look at it if it's a large amount of money involved. Some people are being taken for tens of thousands of dollars, and they are being harmed with this information. So it's really important to read through it very carefully and know what you're getting into. Do not provide any money and a signature until you have a very clear understanding and they are licensed and certified. If it is a huge investment up front, that's another red flag. Even a functional medicine doctor charges you by the hour, usually. So it's not a huge commitment. It's not $5,000, $6,000 up front. That's a red flag. That is usually not appropriate. Are they pressuring you? Are they calling you? Are they texting you? Are they telling you what you want to hear? All of these are things that you should avoid. And then, are they promising you a cure? Are they promising you these fantastic results? There's no promise in any of this. Yes, you will feel better when you're on a better diet, better exercise, and getting the right nutrients, which is why I give this talk in the first place, is so that you have all of the building blocks associated with that, so that you can get good results, and you can make the appropriate changes without getting suckered into some of these bigger programs that cost a lot of money and they're not certified to do it. So again, here's the provider directories one last time. I would look for the provider there first, and then look at their credentials. Any of these sites, they are credentialed, they are safe, and they have to be, they have to go through a rigorous program to get onto those. So in conclusion, inflammation is often a very significant portion of all of the different types of pain, the nerve pain, the myofascial pain, and the joint pain associated with scleroderma. Appropriate nutrition and an anti-inflammatory diet can help reduce those symptoms dramatically. Looking at nutritional deficiencies and what medications do contribute to those nutritional deficiencies just means that you're going to concentrate heavily on the nutrition and making sure that you have a really good multivitamin on board. Stress management and exercise are all very important parts of the pain treatment plan. And then restorative sleep will improve immune function as well as help decrease pain. There are a lot of different myofascial techniques we talked about, and that I find to be incredibly effective along with the anti-inflammatory diet. Celebrate the small victories, start really small, and make sure that you keep trying. So find what works for you and don't give up. So that's my ultimate recommendation there. And then choose an appropriate provider that can help you with the work if that's something that you're interested in. But a lot of this can be found online. So that is what I have currently. If you have any questions, that is my email. If I do not email you back, please feel free to contact me again. It just means it got buried in the email somewhere. I cannot give individual advice on medications because I'm not licensed in every state, and that is illegal for me to do so. But I can give you the education pieces associated with pain. So I do want to open it up to questions. I want to make sure that everybody has that email. Let me get to... Okay.
Okay, everybody, if you've got some questions, go ahead and type them into the Q&A. And we had a couple come to me during the registration process. And a couple of them were very specific to your specific type of problem, which I did send the information to Dr. Harper. And if she felt it was appropriate to answer those, she would. But if she felt like this was something that was putting her in a position where she was maybe playing doctor or diagnosing you during this talk, we felt uncomfortable with it. So if you put something in here that she didn't feel that it was appropriate, she won't be answering that. I do want to say that one person made a comment which that said that she used the holistic approach and made a drastic change to her diet, and she now eats all organic diet. She got rid of gluten, sugar, dairy, soy, corn, and she said it really reduced her pain drastically, and it helped her wean off of most of her medications. And it was just nice to hear that. Somebody that really worked hard on something like this and was hoping to see the changes, and she wanted other people to know that. So I thought I would read that out loud, that that's a great, what would be the word, a journey that she went on, and that she is feeling better. And we know that it's always something that's worth trying. So I just wanted to say that.
Absolutely. And, you know, I do want to say that I've had many scleroderma patients do really well with even just small changes. So just little changes can make a big difference because, you know, making these changes, making any lifestyle change is really difficult and really challenging. So taking it one small step at a time is the best way to do that. Some people can rip the Band-Aid off completely right away and make all of these dietary changes all at once. The list, so somebody did ask for a list of foods. So the list of anti-inflammatory foods, if you just search anti-inflammatory foods, or FODMAP diet, those are also usually anti-inflammatory foods that can be used for a short period of time. But just basically the list that I provided with no processed food, no sugar. Sugar is a really difficult challenge because sugar is in a lot of different products in America. And a lot of the products we have here aren't available in Europe because they're toxic, unfortunately. So it's looking at reading labels primarily. But the list of foods, if you can start with no processed food and no sugar, that's a great choice. When you start getting into the anti-inflammatory diets and looking at all of those foods, so basically dairy and gluten are the biggest ones that they recommend decreasing. But you can go down the anti-inflammatory food list, and just if it's a food, basically concentrating on an anti-inflammatory diet. Once you've done the processed sugar or the processed food and the sugars, no fat, fried foods, things like that, that will help decrease inflammation further by using the anti-inflammatory food list. And then the other question was best non-melatonin sleep aid. It depends on why you're not sleeping. So there's a lot of different options. A lot of people, it's anxiety. And so the magnesium glycinate can help with that, as well as the L-theanine. Both of those can be really helpful for that. And then the cannabis is another one, although it depends on the state that you're in. But oftentimes, if it is because you're not feeling well throughout the day, a little bit of exercise, even if it's just a few minutes, can help significantly with pain or with sleep, I'm sorry. So even if getting out, so I've noticed now that I'm way more active than what I was a few years ago. I don't know if you all knew that situation, but I wasn't very active for years because I was really sick. With basically a scleroderma flare from mold toxicity. And so, I've gone through this process myself, and it was really difficult sleeping during those times. And then when I was getting back into it, it was anxiety. And so now that I'm just busy throughout the day, both mentally and physically, that definitely helps with sleep too.
Thank you.
Any other questions from the live group? I will try to go through the ones on email as well.
Yeah, and Megan says, not a question, but I get my myofascial release done during physical therapy, and it's helped my muscle weakness so much. And I appreciate you saying that, Megan. And we also have a really great video on our website at www.myscleroderma.org under our education. And Dr. Suzanne Nyancy and her physical therapist went through myofascial release and other things that are so important for stretching. And it's really good. And I think that many would appreciate learning more from that specific video if you want to take a look at it. So I just thought I would mention that. And then Lisa says, I'm interested in adding more vitamin supplements into my diet, but I'm nervous about mixing them with medications I take. How do I know they are safe to mix?
So oftentimes the vitamins, so there is, if you look for drug vitamin interactions, there are websites that are available for that. I can look to see if I can get you the exact name for that. Because those vitamins, those interaction trackers often help significantly with what drug interactions there are, because there are quite a few drug interactions, and that's a very good question. And so,
so Joanna, what we can do when I send everybody the recording, I'll make sure that any additional things that we find helpful will be added to my recap when I send that out to everybody. So if you have other links or other websites or anything, I'll make sure we include that in it, and everybody that registered will get that information.
Okay, fantastic. Fantastic. So I'll give you the interaction checker there. And some vitamins, look at that list because some vitamins are fat soluble. And so they can be dangerous at higher levels. And so I don't recommend supplementing with them unless a physician or a naturopath or somebody is involved.
Thank you.
And then any ideas on how to get the 6 to 8 cups of vegetables with swallowing issues? So with those, oftentimes a smoothie in the morning or a smoothie twice a day, they can be thicker in texture, which I know it's not chunks. So if you get a really good blender, I believe I have a Vitamix, and that works really well to puree it really well. But with that, oftentimes there's not an issue with the swallowing. For me personally, it's an issue with texture. Once you can get past the texture of it, because it is a little chunky, depending on how many vegetables you add to it. So you can add a variety of different vegetables. And I can look at different recipes for smoothies and send one over so that you can it's kind of a make your own. You add a few from each list. And then most of the vegetables are raw unless you have a problem with processing raw vegetables, which usually that's, you know that already, or it causes bloating and gas. So if that's the case, you do cook them, but for the most part, they are raw. And then my understanding is that obesity and scleroderma are rare, and yet here I am. I've started Wegovy and have seen much. Have you seen much regarding the effects of it on scleroderma? So any type of weight loss really does help decrease inflammation. That decreased inflammation can help decrease the scleroderma activity as well. In functional medicine, they do believe that all autoimmune diseases are inflammatory based. So there is something that your body is responding to. And if you have the higher amount of inflammatory genes, the more likely you are to have an autoimmune condition. And so that being said, with all of that, as you decrease the inflammation, you usually see a decrease in scleroderma activity as well. But it also depends on if you are in that first couple of years and it's incredibly active, or if it's, you're more stable. So it really depends on where you're at, but oftentimes any decrease in inflammation can help with that.
Thank you.
I have not heard anything about Wegovy itself as far as helping with scleroderma. There's no mechanism that I could see that would work.
Thank you. If anybody has any other questions, feel free to put it in the Q&A. And I was looking at some of the questions that came during the registration process. And one of them said, does muscle tissue turn into fibrosis in late stage scleroderma? If not, why do muscles hurt?
Yes, so that's a very good one. So the myofascia actually surrounds all of the muscles. So just like that picture I had of the webbing by that video that I recommended, that actually surrounds all of the tissues, all of the organs, everything. So with that myofascia, it doesn't necessarily, so that contributes a lot to the muscle hurt. It doesn't necessarily lead to fibrosis per se, but any type of myofascia that is stuck, and so whether that's lack of water, whether that's lack of movement, all of that does contribute to that myofascia sticking. And so that myofascia sticking often contributes to the muscle pain, especially when it's not necessarily related to exercise, because exercise pain is a different pain. But it's that myofascia that makes such a huge difference.
Thank you. A lot of these were just comments from people that I sent you, and you already saw those, Joanna. And somebody was asking about a pain that they had on their left side and if it was their lungs, but I think this is a very difficult answer that would probably be best answered by your physician trying to help make that decision, because it is so difficult to pinpoint what a pain is really being caused by when it comes to scleroderma. Am I correct, Joanna?
Yes, yes. But a lot of the exercises that I have in there, like using the foam roller, especially on the left side, could help if it is myofascial related. If it's internal, as far as actual lung tissue, that's a little different, but oftentimes it's myofascia related. So going along the myofascial recommendations, or using the foam roller as an option to help break up the myofascia that's there. So oftentimes with scleroderma too, like things don't move well, and so that's more myofascial related. And so getting that therapeutic massage, having them go in between the ribs, really moving that tissue manually. You can move the tissue manually too. It just, it doesn't feel pleasant while you're doing it. But oftentimes once you get the movement going a little bit more, it helps decrease the pain.
Thank you. You have another question in the chat box, in the Q&A.
Okay.
It says, is kefir better than milk since the lactose is destroyed by bacteria?
Generally speaking, kefir is better than milk. It is the lactose that's part of it, but there are also other proteins in there. It can still be inflammatory to some degree, but it's better than milk.
Thank you. You see the other ones that are coming in?
I do see that other question. And so the other question was, I stopped using acid reflux medication. Is there something natural? So I was going to include this in with the GI pain, and I forgot. So thank you. This is helpful. So one of the things that I have found incredibly helpful is slippery elm. And I think the lozenges are easier to tolerate. So you basically suck on them until they dissolve. And I actually use that in place of famotidine.
Thank you. Okay. I thought it was interesting, this one comment that I had sent to you, which I think a lot of people, even without scleroderma, can relate to. She says, how to know when to blame my pain on scleroderma. Before even being diagnosed, I called it chasing an illness around my body. And, I think that it's really difficult when you have a disease like scleroderma to try to pinpoint that. And I think it's more common than people would think. But do you have any thought on that?
So believe me, I understand. When I was really sick, I had joint swelling in up to 6 joints, where some of my joints were double their size. So I completely get it, and it felt like it rotated. Once the inflammatory response is so high in the body, it just pops up anywhere, unfortunately. I was having really weird facial rashes, well, body rashes, and weird swelling all over. And that was just meaning that, my CRP was through the roof, the C-reactive protein. It was incredibly high. And so that was my body's response in this incredibly high inflammatory state. So looking at just inflammation overall, it really can be unpredictable when the inflammatory response, or when the inflammatory response is turned on to that degree. So really looking at some of the other, once it gets to that point, I needed medication. I needed, steroids. I actually needed infusion steroids for that. And, I needed to go on immunosuppressants, which I try to avoid, but it's what my body needed at that time. And now I'm at the process of decreasing off those immunosuppressants again. because I'm working on all of the other inflammatory responses. So with functional medicine, it's looking at kind of more of the reason behind why you have high inflammation. So oftentimes it can be a co-infection. For me, it was mold. Or mold exposure, which, I'm in Minnesota. Everything here is wet. So, it's unfortunately just what it was. But I think I probably, had, some issues before, because that would be the reason why the scleroderma was triggered in the first place. So, there may have been other co-infections involved. So that could be, Epstein-Barr, that can be Lyme. So there's all sorts of different things. And it really is important to note too that Lyme disease, you can test positive on a Lyme test, even with high inflammation, even if you don't have Lyme. So I don't recommend chasing kind of the Lyme idea. Some mild detox isn't bad. I did not talk about it this talk, but mild detox can help. So using some type of like Z binder is one of them that can be used basically 1 hour, 1 hour before meals or 2 hours after meals. It does bind everything, vitamins, minerals, medications, everything around that time period. So that is an option to help detox, but any type of aluminum toxicity from like deodorants or Tums, if you can buy the non-aluminum Tums, they do make those, and they actually have a good variety of them now. Same with deodorants. There are deodorants that do not have aluminum in them. Yes, they may not work as well as the aluminum products, but you're also not introducing aluminum to your body. So really looking at all the reasons for inflammation, and the ones that you can deal with directly are the ones I talked about in this talk, and that's the diet and the exercise and the stress management. It is amazing how much those actually play such a significant role in pain management, and how much your scleroderma advances. There are many other factors, so I'm not saying that I'm not, undermining any of the other information, but that it does play a significant role.
Thank you. And Stella asked, what was the name of it again?
Slippery elm.
Slippery elm. Okay. And I just wanted to add that, one of the reasons we thought this was so important is that while this is a talk that she's providing for you that goes over more of a natural or holistic approach, there is an open mind from somebody that prescribes medication when necessary, and I appreciate that she's able to see this from both sides of the coin and make sure that all of you know that even she has had to go on some more aggressive therapies when it was necessary. But as soon as she started feeling better, she made sure that she understood what she was doing. She was an informed patient as well as somebody with a medical background, and started backing off of some of her other medications. But just to make sure that you're always informed to make the best decision. And we really want to encourage you to learn the two worlds. I call them East and West, and putting these two worlds together and finding your happy medium to live your best self with scleroderma, and learning what you can do while you're in maybe some of the most aggressive stages. And when that time comes with somebody like Dr. Harper that understands when you can start cutting some of those things back. So I just wanted to mention that.
Excellent. There is one more question about soy.
Yes.
So with soy, it can have a change in hormones as well. So it can trigger the estrogen receptors. So I don't go really heavy on soy in general, especially in children, but in adults, it's just looking at what your symptoms are, and making sure that, like you don't have any increase in hormonal symptoms, I would say. And also with a vegan diet, just make sure you're getting the nutrients that you need with the vitamins listed, because oftentimes, with a true vegan diet, sometimes we have difficulties getting the amount of nutrients that we need, particularly the vitamins that are found in animal foods. So It just takes more of a conscious effort,
Thank
but it
you.
is less inflammatory.
And thank you for the nice words, Anne. Well, we appreciate that you appreciate this. And we do want to make sure that we're doing everything we can to help our warriors near and far. So thank you. And Lisa, she just said she just got diagnosed with a mold allergy. And Ilana thanked you for this wonderful talk and said that she knows that she'll be able to get the recording later. So if there's any more questions, speak now or we'll be ending the meeting.
I'm good. I do need to get running, but I wanted to thank everybody. My information is there. Please feel free to give me an email if you have other questions. Like I said, this was just an overview. I can't go into excruciating details on everything, but I did want to make sure that the slides are available to you and that, we'll have the resources for the drug vitamin interactions or the drug supplement interactions.
Great. Thank you so much. And again, we're hoping that Dr. Harper and I will be having conversations about additional talks. You're more than welcome to email me, tell me some of the things that you are interested in, and I'm sure that she can put together something that's very helpful. So once again, Joanna, thank you so much for your time today. Thank you for the time and effort for putting these slides together today and for your insightful information. We really appreciate you. I just want to say thank you on behalf of everybody that attended today and the Scleroderma Foundation of California.
Oh, thank you. And I appreciate all of you guys and all of your excellent questions and tolerating such a long presentation. So thank you, everybody. And I look forward to doing more with you.
Great. Thank you. And all the thank yous I'm seeing from everybody. Thanks, guys. It was really nice having you today. Take care, everyone. Have a wonderful rest of your day.
Thank you.
Bye.